Hi, my name is Mark Clough. I'm a sports medicine surgeon here at Towson Orthopaedic Associates. I took a interesting path to getting into medical school. I graduated from college and went into science. And when I was working at Hopkins in a research lab, one of the doctors that I work with encouraged me to consider going into medical school, which I hadn't considered at all up to that point. But growing up with a mother who was a nurse, I heard a whole bunch of stories of, that she would bring home from the hospital, and I think those two things just kind of fell together with pursuing medical school and haven't looked back. I got interested in orthopedics when I was in medical school. I was really fascinated by the anatomy, and as I thought about what I wanted to do, I wanted to operate on people who are active. And so it was just a segue between surgery and anatomy from orthopedics perspective. I'm passionate about my job. I'm passionate about helping patients get better. I love sports. I love taking care of patients who are motivated and have a drive to perform. I think that makes a big difference in terms of how people recover, whether that's surgical recovery or non-surgical treatment. I'm passionate about surgeries that include anything to the knee or shoulder. Those are very common injuries in sports. Athletes come in various ages, and so it can be a ACL or a meniscus tear in a high school student, a rotator cuff tear in a weekend warrior. There's a lot of 60 to 70-year-old folks playing pickleball and tennis, and it's very rewarding to offer them a partial knee replacement or a total knee replacement to get them back playing their sport. I love what I do because I feel rewarded by helping somebody, and there's nothing greater satisfaction than getting somebody back playing sports who was injured. Towson Orthopaedics is an excellent place to come and receive help and care. We've got several subspecialists that cover the gambit as far as orthopedic needs, whether it's hand, foot, sports medicine, joint replacement. We've got experts in all of those fields. Our team is exceptional because we're very patient-centered. We've got good communication, whether that's through the front office staff, secretaries, and through our physicians. We've got multiple physician's assistants that also help in communicating to our patients and having them receive appropriate care. One of the other things that makes Towson Orthopaedics great is that we've got multiple office locations, Bel Air, Harford County being one of them. I'm a Harford County native. I went to high school and middle school here and have family in the area, and it's really just been a joy to see patients who are friends of mine or their children, and be able to have a friendly face for them to see that they may know or have family members that might know.